So my name is Dr. Tim Gatheral. I'm a consultant respiratory physician based in the northwest of England, predominantly in Lancaster and Morecambe Bay, but also Preston. So I decided to become a doctor many years ago. I was always interested in science and how we sort of investigate and understand the world around us as a student at school, and therefore had a natural inclination towards medicine. Unfortunately, my father was very ill when I was young, and had a lot of contact with doctors and surgeons in hospital. I was always struck with, the seriousness by which they undertook their work, and how, important it was waiting for their opinion, and how crucial that was to be able to get on with life, certainly as a family. So that really had an influence on me in a positive way, and I saw that as that sort of career as something to aspire to, a role model, if you like. So I did well in my studies at school, and was able to get a place at medical school in Cambridge, which set me up for a future career of very inquisitive medicine, and it's a lifelong learning journey. So in terms of my choice of specialty in respiratory medicine or pulmonology, I had a very general training, as all junior doctors do. I decided fairly early on that I wanted to be a physician rather than a surgeon. I think I was really interested in the diagnostic aspects of medicine as a profession, and that sort of detective work at getting to a diagnosis that's involved. I had some excellent mentors just before my time to choose specialist training, and particularly good mentors in respiratory medicine. And I really enjoyed the breadth of that specialty, the fact that there's a mix of very practical skills with interpretation of tests, and also that long-term follow-up. Respiratory medicine is all about chronic disease, and taking a patient through a journey of diagnosis and treatment and support, whatever that disease is, and that really appealed to my style of medicine. I was also lucky enough to be able to have a very really detailed attachment and intensive care around the time I had to make my decisions about a specialty, and that's very closely allied to respiratory medicine. So again, those are really the main reasons that I chose my specialty, and certainly haven't looked back. It was a good choice. So I'm very lucky to have the job I have. It's a challenging job and frequently tiring. The demand is high, and available time is often limited, but it's always rewarding, always changing, an interesting job. I learn new things all the time. It's a privilege to be able to get to know your patients and get to understand each and every one of them, and follow the journeys through of investigation and treatment. That's a privilege that all doctors have, and that always sustains me in my work. I get to work with a fantastic multidisciplinary team throughout primary, community, and secondary and tertiary care. So lots of fantastic colleagues, and I think that's a really important factor in supporting me in my work and continuing to make it enjoyable and relieving stress. So respiratory medicine has lots of challenges at the moment. I think it's fair to say that a large majority of the consultations that the patients have with their GP or bring into hospital often relate to respiratory medicine, respiratory infections, or chronic respiratory disease. There's a massive demand out there, and certainly at the moment within the NHS sector, there's tremendous pressure, and backlogs have built up in terms of investigation, treatment, and clinics. So that's not just specific to respiratory, but it's certainly a problem we face in respiratory medicine. There are diseases that I'm particularly focused on, including interstitial lung disease, that remain challenging. We are beginning to have exciting new treatments, but it's taken a long time to get to that point, and we have a lot of patients with significant symptoms to try and help, and disease progression to curtail, and we hope that that's an increasing, an expanding journey of new discoveries and new drug discoveries that will enable us to treat patients more effectively going forward.